Hi, I'm Dr. Gautam from Love Chef GSD Kennel. To introduce myself, I am a human doctor. I specialize in oral and maxillofacial medicine. I have been associated with German Shepherds since 1995 and I've been breeding them since 12 years. So I welcome all of you to this channel, and I'll be rolling out videos on frequent basis which will be helpful to the pet owners and breeders. So today's topic is bloat. The scientific name for the bloat is gastric dilatation and volvulus. Let's stick to the term bloat over here. Let's not go into GD and V. Basically, it's GDV. Uh, let me make it more simple. Gastric dilatation means expansion of the stomach, and volvulus means twisting of the stomach. So let's uh, stick to bloat, which is more simple for all of us. So it's bloat is a life-threatening emergency that can cause death within 4 hours if left untreated. This I have experienced firsthand, as I lost a male dog about 4 5 months back to bloat. The bloat started at 8:30 and the dog passed away 12:30. So I have seen firsthand the various stages the dog goes through in bloat. So that's one thing about it. Then the next thing is in bloat the stomach is filled with gas and liquid, and of course food, that causes the stomach to expand and twist up to 360 degrees. Along with the stomach, the spleen also twists. Let me tell you what is spleen. Spleen is an organ that is situated next to the stomach, and basically spleen is an organ that it basically helps in filtering the blood, and it produces blood cells such as platelets. So even that is involved. The Once the stomach expands, it causes few things. The first thing is it as it twists, the gas and the fluid whatever is in the stomach cannot escape because it has twisted. The second thing is it prevents expansion of the lungs. As the stomach expands, it becomes so big that it presses the rib cage upwards, so the expansion of the lungs becomes very difficult and the dog is unable to breathe properly. And at the same time, it causes the blood supply to the heart reduced to a lot of extent. That's because the dilated stomach, the expanded stomach can compress on major blood vessels supplying blood to the heart. So blood supply to the heart also is reduced to quite an extent. And finally, it also ruptures the spleen. So as I told you, that spleen is associated with the stomach. So the spleen also is ruptured. So all these four things happen in quick succession. And uh, and this is the video of the stomach along with the spleen, the black one, that is expanding and twisting over to almost 360 degrees. So this is the end result of the bloat that happens at the end of 4 hours, and this leads to the death of the dog. This is the video once more. All of you can see once. That's the twisting over to 360 degrees. The bloat has two stages. The first stage is where the stomach expands or dilates, and the second stage is where the stomach twists over along with the spleen. So let's first see here the normal anatomy of the dog's digestive system. So here we can just stick to points F, C, E, and D. So F is the basically the esophagus. The esophagus is the one that carries the food from the mouth all the way up to the stomach, that is the C. And E is the pylorus that takes the food, digested food, from the stomach towards the small intestine. So in bloat, the C, E, and F, all these three parts are involved. And because of the twisting out of the stomach, the food cannot escape from F and food cannot escape from E. I hope you got the point. C expands, which causes twisting of F and E. So as a result, the food cannot go either way, exit or entry. This is the first stage of the bloat, where you can see the stomach has been distended with gas and fluid and food, whatever. At this stage, you can manage it. The dog can be treated and it will survive without any surgery, just by decompression. If not treated at that stage, it can progress to the volvulus stage where the twisting happens. And here you can see the stomach had been twisted along with the esophagus and the pylorus. You can see the same reference points they have mentioned out there. They have been twisted, and you can see the dog that is been standing. This position in which the dog is standing over here, that is called as prayer position, or hunched up position. So prayer position and hunched up position. These are the two positions you need to remember. Now, what are the factors that may lead to bloat? The first thing is family history. Family history or the genetics plays an important role. So whenever you buy a puppy, you always make sure that the you do a research about the family history of the animals, so that there is no bloat and all. Apart from bloat, you can also do a check on various other genetic diseases such as hip dysplasia, etc. The second thing is dogs that eat very fast. There are dogs that are very uh, eat very fast. Dogs that are very deep chested, such as Dobermans, German Shepherds, and Great Danes. Dogs that drink water very rapidly. Dogs that are stressed. Dogs that are over 40 kilos or 80 pounds. Dogs fed from an elevated bowl. Dogs fed one meal a day. Dogs that are fed only dry food. Dogs that are 7 to 12 years of age and exercise immediately after feeding, and feeding immediately after exercise. So, the point that says that dogs that are 7 to 12 of age is not exactly true, because that is what the studies say. But the dog that I lost was only 4 years old, and it was a male dog. So, and then feeding from an elevated bowl. I mean, I've seen many breeders and pet parents feeding their dogs from elevated bowl. They may think it is controversial, but studies literature have clearly shown that feeding from an elevated bowl adds significant risk towards bloat. And drinking water rapidly. So these are the factors that may lead to bloat. What are the signs of the bloat? Like, how do you identify that it is a bloat? There are some 7 signs. The first sign is the stomach is very round, hard, and it is swollen, and it feels like a small ball. And upon tapping, you get that drum like sound. You get a drum. When you tap on a drum, you get that sound, hollow sound. This is also called as tympanic sound. The dog is standing in a hunched or prayer position, as I've shown you earlier. It is trying its best to vomit. It cannot vomit because the stomach is twisted, and it drools with lot of foamy, frothy, sticky saliva. It's restless and always keeps moving up and down. It's confused as to what's happening. The facial expression is anguished. It's totally, it shows a confused face. You can hear the dog crying loudly, and in the later stages, it's having difficulty in standing up as the uh, back legs they crisscross each other. The dog has difficulty in breathing in the last stages. Finally, it collapses and passes away. So these are the various signs of the bloat that can one can see in a dog that is progressing to bloat. the final stages of the bloat. So here is a video of a Akita. Uh, this is before the bloat has developed. Here it's somewhat kind of, it's feeling something is wrong inside its body. The stomach is not so swollen, and here you can see the stomach has bit swollen a bit, and the dog is trying to vomit. This is the prayer position, hunched up position. Here you can see that here the stomach itself is quite big. You can, it's very prominent now. The stomach is dilated and it is trying to vomit, but nothing comes up. And here it has vomited foamy white liquid, and the dog keeps pacing now here, and it keeps pacing up and down. It is very confused. It doesn't know what's happening. And at this stage, if you add water to it, it will definitely drink it. But the water cannot reach the stomach because, as I told you, the stomach has been twisted. So the exit and entry routes have been cut off. So it will drink, at the same time it will vomit again. And the face also shows a lot of anguished look. Let's see here. Here you can see that it's drinking a lot of water, and you can also see its face now. It will be very anguished, confused look, dilated pupils. See over here. See the dog, how confused it is. And at the same time it will throw out, because since the water can't reach the stomach, the dog will immediately throw out. Here you can say it is throwing out whatever it has drank. It has to come out because the entry and exit routes of the stomach have been cut off because of twisting. Now how do you prevent bloat? Feeding a raw diet is obviously a simple answer, but it's very difficult to implement, uh, because, and it's time consuming. It's definitely the best diet you can give to your dog, but it's time consuming, laborious work, but the results are beautiful. Those who can afford it, and those who have a lot of time, can go for it. You can also soak the dry food in water. You can feed dogs using bloat bowl. Bloat bowls are basically, these are bowls are that are available on Amazon, on Flipkart. Here you can see it's basically like a jigsaw puzzle, and the food has added to that. And so the dog that eats fast cannot eat fast over here, because it has having all sorts of puzzles over here. So it needs to slow down a bit and eat. So this is a bloat bowl. You can at least feed it 2 meals a day instead of one large meal, one large heavy meal. You can distribute meals for 2 meals a day. You can even make it 3 meals if you want. Stop feeding from an elevated bowl. Give food 60 to 90 minutes after an exercise. Give a gap of at least 1 to 1.5 hours, or to a greater extent 2 hours after exercise. Avoid exercising after feeding for approximately 3 to 4 hours, and try to avoid strenuous exercise during summer, because of the heat the dog will tend to drink water very fast. So I told you previously that dogs that drink water fast also can be prone to bloat. So try to exercise in the summer during early mornings or late nights. So if you encounter such a condition at your home, and you may think like what to do before I go to bed, do I do something? Yes, you can do a few things, and these are the over the counter medications you can buy. These are the basically simethicone and activated charcoal tablets. They're available, I think, even in Big Basket they're available. And you can also buy this Gelusil syrup. So these two are the over the counter medications for to at least make the dog comfortable to a certain extent. You can always keep them handy in your house. But as always, if you see the signs of bloat, it is best to take the dog to the vet. So once you have administered the over-the-counter medications, you need to rush your pet to the veterinary doctor at any cost. But make sure you rush the dog to the veterinary doctor who is having the surgical facility. Always do the homework and save the numbers of the veterinary doctors who are having surgical facility, because this is a condition where you just cannot give tablets and everything will be fine, ऐसे नहीं चलता है, but you need to give medications, and the surgery has to be done, and the surgical procedure can be positive or negative. Positive means the dog may recover or the dog may pass away, so that's a gamble. You need to be ready for anything. And in case in if you have a dog or a female bitch that whom you're going to spay or neuter, you can always think in terms of gastropexy. Gastropexy is a surgical procedure wherein the stomach is sutured to the abdominal wall, so that prevents future attacks of bloat. So hope this uh, video was useful to all of you. If you do like my video, hit the like button and press the subscribe button. And I wish all of you a good day. Bye bye.